Ariana requested a video about how to tell your therapist that you feel suicidal, and that's this one. So welcome, my name is Mallory Grimsty. I am an actual teen therapist. I'm here to help you improve your mental health, and if that's something that you're into, please be sure to hit that subscribe button and turn on that bell notification. That way you're notified every single time I release a new video. So this topic can be a little triggering for some people, and rightfully so. Suicide is the 10th leading cause of deaths in the United States. We know how serious this can be and how impactful it is to everyone's lives, whether you've experienced this or someone in your vicinity has experienced this. So if you need to pause and take a break or come back to this later, or even have a friend watch it first and give you the information, I'm totally 100% okay with that. I fully support you taking care of your mental health. And if at any point any of this feels too overwhelming or too much, or you start to realize that you need help right now, make use of your local crisis support numbers. If you start experiencing any sort of suicidal thinking or urges, it can feel really scary, especially if you've never had those thoughts or urges before. So it's really important to take some time to get to know your therapist. It's important that you feel comfortable with them. It is our desire to create a welcoming and safe space for all of our clients to feel easy talking with us about the icky things. We also know that we're not one size fits all. If you can believe it, I'm actually not everybody's cup of tea. If you ever look at my reviews, you can see that. But that's okay. Getting to know your therapist and letting them get to know you will make it easier to talk about these thoughts or these urges as they occur. Now, we do not expect you to divulge every single piece of your life or every single experience in just one session. We know that we are limited by time, and so we really try to do our best to get to the hot spots in what is impacting you currently and keeping you from living your ideal dream life that you're trying to create here. So when you do decide to share this information with your therapist, please be clear and direct about it. It is not a wise idea to leave it open to interpretation. There are varying different levels and elements of suicidality and what intervention we would recommend. And so our ultimate goal is to help you achieve your dream life, whatever that is for you, in the healthiest way possible. So I know a lot of people are really fearful and worried that if they share with their therapist that they're feeling suicidal and they're really direct about it, that means an automatic ticket to the hospital. And for some therapists, that is true. I'm not gonna lie. But for many of us, we're not trying to send you to the hospital unless you absolutely need it. We want to exhaust all other options before we go to the highest level of care. That's what we call hospitalization. Now, keeping that in mind, mental health therapy and counseling is a wide field, and there are many specializations within that field. I happen to be somebody who specializes and is highly trained in suicidal thinking in teenagers and self-harm or self-injury, anxiety, and depression. So those are where I feel most comfortable intervening and assisting clients. So keep in mind that if you happen to be working with a therapist who isn't trained yet or isn't comfortable treating people who experience suicidality, they may refer you out to somebody who is more skilled and trained in that area. It's kind of like when you go to your pediatrician or to your primary care physician, you come in for an exam because your eye's been hurting you, and they say, we can try these eye drops, let's see how it goes. They try the eye drops, but it's still hurting. So they may then refer out to somebody who actually specializes in that body area. Same is true for mental health therapists. It's not to say that they're not a good therapist. It's not to say that they're not even a skilled therapist. It's actually healthy and a good sign if a therapist knows their limitations on their expertise and can then link that person up with the appropriate help and care that they deserve and need. So for example, while I do have teenagers who have struggled or used things like marijuana or vaping or drinking in the past, I am not a substance addiction specialist, and if it gets to that level, it's important for me to link that person up with somebody who can give them the right care that they deserve. So as you tell your therapist about your experience with suicidal thinking, they may also ask, who are the supportive adults in your life? And this is so important. We know that we only get like a short amount of time out of your day, out of your week, out of your month, however frequently we're seeing you. And so we want to make sure that you have enough supports around you outside of the therapy room so that if we're not immediately accessible or available, that you have other people in the meantime that you can connect with on a daily or periodic basis. So some supportive adults that you could consider are your parents or a caregiver. It could be an adult family relative like an older brother or sister or an aunt, an uncle, or a neighbor. It could be a school teacher or a coach. There are endless possibilities here. So you just want to consider who in your life could potentially be a supportive adult if you are going through these experiences outside of therapy. This is not a situation where it's a good idea to go it alone. Being able to let that person know what's going on, what helps, and how they can be helpful, and if they are up to that task or challenge is really important too. You want to be set up for success here. If you're having trouble struggling with talking about your feelings, I highly recommend that you get your free copy of the cheat sheet that I created just for you based on your input and feedback, and that is the 10 therapist approved tips for talking about your feelings. You can get that by clicking the link in the description, and I'll send that directly to you. Please know that these are never one and done conversations. It is so important to keep talking about it. We know that just because you have suicidal thoughts and you talk about it once, we hope that that's the end of it, but that doesn't mean that it is the end of it. It's so important that you keep checking in and you keep talking about it. And if your therapist is not bringing it up, call them out on it. Be like, hey, you haven't asked me about how I'm doing with my suicidal thoughts or urges in a while. Are you going to ask? It is so important that you know what coping strategies work best in high stress situations, which is why I highly recommend that you check out the video on your screen right here. It's where I'm talking about the 4 DBT crisis survival skills. You can't get much better than that. And if you found this information helpful, please share it with somebody. You never know who you could be helping in the process. Thanks for watching.